This is a case of 32-year-old female patient with hypothyroidism, TSH 13, normal levels of free T3 and T4, and moderate excess of antibodies to TPO and TG. This is the left lobe of the thyroid in a transverse projection. The yellow marks show the body of the lobe. The tissue of the lobe is predominantly slightly hypoechoic. This is a sign of stromal swelling. In some places, the tissue is moderately hypoechoic. There are also significantly hypoechoic lobules. I pass the sensor over the lobe from the cranial pole to the caudal. As you can see, similar full-fledged hormone-forming tissue is continued everywhere. I also scan the lobe in the longitudinal projection. From the cranial to the caudal pole, sometimes to the sides. A small number of significantly hypoechoic lobules and a medium-sized segment of the dorsal edge of the lobe become better visible. I specially placed measuring marks. The value correspondence of the average size of the segment. I repeat, this is not a nodule. Some doctors may mistakenly describe this area as a nodule. In the colored Doppler mode, with basic settings, low amplification and intensity of the blood flow are determined. In placed even up to moderate intensity. Peak blood velocity in the superior thyroid artery is 34 centimeters per second, and in this first order branch 25 centimeters per second, with a norm of 20 to 30 centimeters per second. In the transverse projection, a borderline value between the norm and low amplification is also observed. The thyroid isthmus has a normal thickness, moderate stromal swelling, and a small number of significantly hypoechoic lobules. In the right lobe, we see significant predominance of full-fledged hormone-forming tissue. In this transverse projection, a medium-sized segment with hypoechoic lobules are determined. This is not a nodule. This segment is located almost in the same place as in the left lobe. This is not an incident, but a pattern. In front of you is a echoic lobule surrounded by thin, significantly hypoechoic tissue. This is a sign of completed intralobular regeneration. In Doppler mode, with basic settings, we also see a slight increase in blood flow intensity. This is a sign of the corresponding magnitude of nerve stimulation of the thyroid tissue. As is known, thyroid tissue in hyperthyroidism is excessively strained to produce a sufficient amount of T3 and T4 hormones. This is confirmed by blood test data. Of course, such excessive thyroid activity is accompanied by depletion of this tissue. We see this in individual lobulus and medium-sized segments. The peak systolic blood flow velocity in the right lobe increased to 94 centimeters per second, which corresponds to a slight excess. The entire gland contains about 97% of full-fledged hormone-produced tissue. Please pay attention to the text of the ultrasound protocol.